Some international news. United States President Donald Trump has announced that he will set up a second coronavirus task force comprising health practitioners and business people to advise on when to reopen the country's stalled economy. The advisory council is expected to include the Treasury Secretary Stephen Mnuchin and White House Senior Economic Advisor Larry Kudlow, among others. The news comes as the country faces crippling job losses, with close to 17 million people filing for unemployment benefits in just the last 3 weeks. Trump said the names of the council members would be announced next Tuesday.
It's a very big decision. I don't know that I've had a bigger decision than that when you think, right? I mean, think of that decision. Somebody said it's totally up to the president. I saw this morning. It's totally up, and it is. I don't know that I've had a bigger decision, but I'm going to surround myself with the greatest minds, not only the greatest minds, but the greatest minds in numerous different businesses, including the business of politics and reason. And we're going to make a decision, and hopefully it's going to be the right decision. I will say this, I want to get it open as soon as we can.
Trump has also confirmed that they now expect the death toll from the COVID-19 outbreak to be far lower than earlier estimates of above 100,000.
Minimum number was 100,000 lives, and I think we'll be substantially under that number. Hard to believe that if you had 60,000, you can never be happy, but that's a lot fewer than we were originally told and thinking. So they said between 100 and 220,000 lives on the minimum side, and then up to 2.2 million lives if we didn't do anything. But it showed a just tremendous resolve by the people of this country. So we'll see what it ends up being, but it looks like we're headed to a number substantially below the 100,000. That would be the low mark. And I hope that bears out.
And for more on this and other developments from the world's epicenter of the virus, we join now via Skype by U.S. Correspondent Sherwin Bryce-Pease, who is in New York. Sherwin, I must ask this question because I know you and I have spoken about it before. The estimates of deaths, you have President Donald Trump there saying it's going to be substantially far below the over 100,000 mark, rather. Is there a quiescence to this figure, especially from the medical task team that's helping him?
Very, very much so, Tsipi. So the models essentially predicting initially between 100,000 and 240,000 dead. Those estimates have now been reworked. You know, as they explain how these data models, these predictive models work, is the more information over time that you can input into the computer, as it were, into the technology that creates these models, the better and more accurate the models become. So at the beginning, the estimates were between 100 and 240,000. Now with additional information, you've seen the posture of the federal government change. You've seen ventilators being distributed, hospital beds and ventilator capacity increased. So the models and the social distancing being implemented, so that new information input into the data set has now revealed that death toll would probably come down to around 60,000, but that too is a prediction, and that too might change over time. So absolutely some good news in that sense, but 60,000, Sipiso, is still a really high number of dead.
So let's talk about then the second task force that will advise President on when to reopen. What does it say about the current task force that has been advising him to date? Does it cast aspersions or doubt on the work that they've done thus far?
It's just another announcement that the president is able to make. It's part of the showmanship that he has brought to these coronavirus briefings daily. It's something now that he's put on the calendar for next Tuesday, so that will be kind of the narrative as we move towards that over the Easter weekend. But you also mentioned in your introduction that Larry Kudlow, the director of the National Economic Council in the White House, and the Treasury Secretary Steve Mnuchin will be part of this new coronavirus. But I might add that they are part of the current coronavirus task force. And if you listen to the likes of Governor Andrew Cuomo of New York, essentially the man at a state level at the epicenter of this virus, he was cautioning that, it doesn't matter about announcements, it doesn't matter about new names. We will be guided in terms of reopening the New York economy based on the public health, the ability to arrest the public health emergency. So whether you have business people getting around the table, part of that new coronavirus task force will include some of the same health practitioners that are part of the current one. So it does sort of raise questions as to the veracity and the need for a new coronavirus task force. But that said, what the president is trying to do here, he's trying to have a team that is going to look specifically, Tsepiso, at which parts of the country are able to reopen again, which parts are going to take longer. But again, this is a decision that cannot be vested in only the White House. Decisions to close economies have been taken at a local level, at a municipal level, and at a statewide level. So as much as the guidelines you get from the federal government come to the fore, this will be a guideline pronounced on perhaps by the president in the days and weeks ahead. But essentially the decision will come down to what is happening on the ground at the state and at the city level. And so as much as Andrew Cuomo made the decision to close New York's economy, it will be Andrew Cuomo and governors like Andrew Cuomo who will make that decision. And he also made a very important point. New York City, Tsepiso, is in a tri-state area. You have people that live in New Jersey and live in New York, in Connecticut, but work in New York City. So, if you open one state, there has to be coordination with another state. So you can't just take decisions as it regards reopening the economy in silos. There has to be some level of coordination. So even if things improve in, say, Connecticut and are not improving in New York, it's going to be difficult to open Connecticut without reopening New York as well. So it's a complex decision, and perhaps the task force come Tuesday next week will be able to provide a greater deal of clarity that's needed on this question.
Sherwin, there's been a lot of intrigue around this particular matter. Republican members of the House of Oversight Committee writing to the WHO Director General, raising a series of concerns and questions about their initial handling of the outbreak. What exactly are they asking for, and what is the likely outcome of this exchange?
Yeah, this is the latest iteration from the GOP, the Republican Party. You've also heard the president talk about withholding funding to the WHO. I would point out that about 17% of the WHO's funding comes from Washington, around $500 million. The Republican members of the House Oversight Committee, let's emphasize that, they have written to Dr. Tedros asking for documents related to their engagements with Beijing, dating back to August 2019 up to the present day. They also want documentation in terms of their interactions with the government of Taiwan. You will remember that Dr. Tedros sort of mentioned he's spat with the Taiwanese regarding some racist overtures that he made reference to. But the Taiwanese raised issues as early as December 31st with the WHO, talking about pneumonia-like cases being treated in Wuhan, China, in isolation. And they are saying by referencing this medical isolation, they were talking in that sentence about human-to-human transmission. And so the GOP is raising questions about the delay in terms of the WHO pronouncing on human-to-human transmission. On January 12th, Tsepiso, they tweeted that there were no signs of human-to-human transmission. So this is where Taiwan, that is not a member of the WHO, but raised concerns about possible human-to-human transmission as early as December. So what you're seeing here from the GOP posture is to divert attention to the mistakes and the missteps from the Trump administration, and really focusing their attention from a Senate level, from a House level, from the White House level on the missteps and failures of the WHO. But what you are seeing certainly from leaders, particularly in the African continent and elsewhere, is this coalescing around Dr. Tedros. Certainly from social media, the hashtag we stand with Dr. Tedros. So it's going to be interesting to see what sort of leverage the Republicans in the House of Representatives have on this issue, because they are, of course, not the majority in the House.
Sherwin, thank you very much. Correspondent in the US, speaking to us via Skype in New York, Sherwin Bryce-Pease. And we come back to South Africa. And by the way, Sherwin had mentioned earlier on that whilst America is seeing death rate of almost 2,000 people daily, they are starting to see a flattening of the curve. We're obviously way behind that, as we're still only starting our lockdown 2 weeks, or should I say, we are still about 2.5 weeks to go, but there is an expectation of a spike in the figures, and Gauteng is the epicenter of that COVID-19 figure in the country. But some residents are oblivious to the dangers of this killer disease. That's a question some people are really wondering. Lockdown don't comply.